Medicine joins us. Good morning, Dr. Bradley Freeman. Are you there? Dr. Bradley Freeman? Are you available?
It really did work in
It was
rehearsal.
there. It worked just like practice last night when we went through the walkthrough last night. It worked without a charm. Now there you are. Doctor, are you there?
Yes, sir. Morning, McGraw. Morning, Kelly.
Good morning.
Thanks for checking in with us. You passed on a story from the Wall Street Journal, which is kind of interesting, and that is these big companies are now starting to really pay attention to their employees' health. Tell us what's going on.
Yeah, so this is a recurring theme, as we talked about a couple of weeks ago. Employers are interested in employee health from a number of reasons. Number one of which it's a big expense, so they're very invested in maintaining and promoting health. And so this is kind of an interesting strategy, is that there are these companies now that have buy from data brokers individual employees' browsing habits. And you would say, well, what is the point of that? And it turns out that browsing habits probably predict a lot about one's health status and interests. So you could imagine that if you had an employee who spent a lot of time, say, browsing about video games versus an employee that browsed a lot about, road bikes or that sort of thing, they might have very different health interests and lifestyles. And then they essentially merge this information, so this browsing history, and they merge it with insurance data claims. And it allows them to really drill down and understand individual health practices and interests. For instance, if you had an employee who, say, started searching for baby products and then looking at their insurance data, they stopped having their oral contraceptives refilled, you would know that they're probably interested in fertility and in getting pregnant and childbearing. And then they might be targeted with things to, say, promote that. So they might be given or fed information electronically about, say, prenatal care and how to choose a obstetric provider and those sorts of things. And conversely, if you, say, had a patient that, had a lot of prescriptions filled that might be related to chronic pain, such as back pain, and they spent a lot of time searching for, say, providers of back surgery, you likewise might give them alternatives to spine surgery or physical therapy or that sort of thing. So it is very analogous to what happens in marketing and what happens into politics, and it really is kind of using big data micro-targeting as a strategy to really tailor health information to the employees.
That tells me one very important thing: don't browse at work.
Well, it's interesting what it provides, and one of the interesting things that came out of this article, which is a very interesting point, you can infer someone's credit history from their browsing, and that relates to say the likelihood that they might be rehospitalized after hospital admission, just because they might not have the finances to, say, get medications filled or follow up with physicians and that sort of thing. So the browsing history is increasingly going to be very important. Kind of a very important piece in understanding people's individual health.
What's this other story you passed on about genome testing? That sounds interesting.
Yeah, so this is interesting. So, there's a lot of promise in genetics, and so there are companies, as we're all aware now, that do direct-to-consumer genetic testing. And I don't mean to promote any company, but probably the most prominent one is something called 23andMe, and for a relative small amount of money, they will send you a kit, and you provide them with saliva, and then you get a report that theoretically gives your predisposition or likelihood of getting chronic diseases, and it can tell you about your heritage and your ancestry and all sorts of things. So this was a study that asked a very basic question: what do people do with that information? And the upshot would be, it would appear, not much, and specifically less than half of the individuals who participated in this service discussed or disclosed those findings to their physician, and amongst the ones that did, they didn't really have a very favorable interaction with the physician. And I think it speaks to the fact that in 2016 even, it's hard to know what to do with this data, meaning for the vast majority of people who would use this service, probably with respect to health alone, the information you get back is probably not terribly earth-shaking. And I think that just speaks to where the technology is. And I think this is one of those things where you have to stay tuned. And as the technology improves and how we learn to interpret that data improves, that this might become a very viable source of information. in terms of direct-to-consumer genetic testing. But as it stands right now, I think it's something that people do out of interest. I'm not sure it has a tremendous impact on their personal health.
Dr. Bradley Freeman, Washington University Medical School surgery professor. Thanks for checking in.
Have a great day.
8:20.